patient navigation is incredibly important, and AONN Plus really focuses not only on nurse navigation, but patient navigation and social work navigation. It's really important as a clinician that we're involved on a policy level because that's like a big key way of changing things for our patients and families. So I think the opportunities are endless. And I think anytime something new comes along, we get scared.
Hello, everyone. Nice to meet you again to another edition of Beyond the Cancer Diagnosis interview series. Today is my pleasure to welcome Jennifer Bires. She's a social worker, and it is my pleasure to introduce you today. Jennifer, thank you very much for accepting my invitation.
Glad to be here.
And for being with us today. I know that you are involved in many aspects of what we are calling psychosocial oncology. To begin our interview, could you please introduce yourself as an expert or as a person, Jennifer Bires, in the field of psychosocial oncology working for cancer patients?
Yeah, sure. I'm happy to. And thanks for inviting me. I am the executive director of Inova Peterson Lake with Cancer. Inova is a health organization in Northern Virginia, and I oversee many of the supportive care aspects and integrative care. So I have an incredible team of behavioral health therapists, nurse navigators, dietitians, acupuncture, massage, and really robust fitness programming and other programs to support patients and their families as they go through a cancer diagnosis. I think so often we really focus on the physical aspects of cancer, but we know that the emotional and supportive parts are equally as important. And so that's where I spend a lot of my work.
So to understand this, let's say like a campus where all these specialties are integrated.
Yeah.
That's interesting.
We have a 5-hospital system, but embedded in each oncology clinic, we have basically the team that I've mentioned in a space for them to work out of so that they're integrated into the way we provide care at Inova Shark Cancer.
That's really great because this is the purpose for every, let's say, psychoncologist or for every person involved in psychoncology to succeed in integrating a team and patient to have to choose from or to go to where he or she needs to be. I know also that you are holding different national positions in different organizations, and I mentioned here Association of Oncology Nurse and Patient Navigators and Association of Community Cancer Centers.
Yes.
Could you please share with us the missions and values of these organizations? Because patient navigators nowadays are very important. From my perspective, nurses, let's say, first line of defense when talking about the cancer patient, so a huge role for nurses and the community. We all are part of a community. So which are the mission and values?
Yeah. Patient navigation is incredibly important, and AONN Plus really focuses not only on nurse navigation, but patient navigation and social work navigation. And I agree, cancer is incredibly complex and humans are incredibly complex, and many come from different social or economic situations. And so navigators, whether it's a patient navigator or a nurse navigator, can really do an important job of making sure that patients have access to the resources that they need to get through cancer care successfully. And AONN Plus has really, built themselves as a home for navigators. It's a place for navigators to get resources, to learn from one another, and to get education so that they're able to provide the best care possible to patients and really help them navigate what can be a really complex situation and healthcare system. And then the Association of of cancer care centers is also an incredible group of folks that's multidisciplinary and works to ensure that cancer centers have access to the resources and education that they need to provide exceptional care. I think one of the things I really like about ACCC is their ability to bring together multiple disciplines and also create educational materials that allow us to learn from one another and not have to reinvent the wheel in very busy situations. And both of the organizations also do a lot of work in the policy space, which is certainly important as we work to move the needle forward in cancer care.
You mentioned policy, the term policy, and I would like to ask you two questions. First, I notice nowadays that starting with let's say political change in the US, more and more executive courses on oncology, psycho-oncology approach this issue of health policies as a major component of the course, even though it's done for specialists like me, like you. So this is one of the aspects that I noticed recently and with a huge impact worldwide. This recommendation of having health policy, at least, let's say, 1 hour for executive education. What do you think? It is useful for us as specialists to know something about, let's say, the big picture of the field?
Yeah, I mean, we're oftentimes on the front line. And so I think as a clinician, being able to understand the patients that I'm caring for and their needs, but also understanding how to advocate for different policies is really important. I think without the knowledge of the day-to-day experience of patients, of the billing system, of how things work, it can be very complicated to really advocate for meaningful change. And so I think it's really important as a clinician that we're involved on a policy level, because that's like a big key way of changing things for our patients and families. And then, of course, it's always our responsibility to advocate on an institutional level for policies that we see impacting the people that we're treating and serving.
It is very interesting and also very important, because in Europe, it's not the opposite, because all the organizations are more or less not guided by policy issues, but more by policy issues than specialists. And we have this lack of understanding each other, because one is theory and the other one is practice. And now I'm coming to the second question that I want to ask you. You are an expert, yes, on living cancer patients, on how they manage through the illness. And we all know, and we are all aware of this gap between medical oncology and the, let's say, psychosocial oncology. It's like a paradox. Sometimes it seems that we've developed into separate ways. Yeah, medical oncology going forward multiplies itself, and we not quite in the other direction, but not on the same rhythm or constant like the medical oncology evolve. What is your opinion as an expert? Is this gap so? What do we need to fulfill a little bit of this gap between medicine and psychosocial issues?
I think, yes, there's certainly still a gap, but I will say in my time working in oncology, I have seen incredible strides of this gap becoming much shorter. I used to have to work really hard to get oncologists to refer their patients to me and to understand the importance of psychosocial services. And now folks are, begging to work with us, inviting us to be on part of the team. So I do think that the understanding of whole person care has shifted so much, even in the last 15 years, which makes me really hopeful. But there's still a lot of stigma when we think about mental health. And I think when we think about an illness like cancer, it can be incredibly overwhelming just to figure out what kind of treatment that you need and how you're going to fit it into everyday life, that it can be hard to layer some of the psychosocial supports on top of that. Which is why I think it's really important that we make things accessible and help people understand that cancer isn't just a physical illness, that it really can have very deep emotional ramifications, and that those are just as important to receive attention as the physical care. And, there's even been some studies showing improved immune function when people do feel emotionally supported and have what they need. So I agree, yes, there's a gap. And I think some of it really lies around stigma and just how we think about mental health. But I also have really seen huge shifts in my career, and really that gap getting smaller and smaller, and even patients demanding access to this type of care. So I certainly think while we have a long way to go, we're moving in a good direction.
Talking about patients and about mental health, did you, let's say, not face, but did you work with cancer, with oncological patients with severe mental illness also, or this category of patients have a distinctive, let's say, approach in your career?
Yeah, of course, cancer doesn't discriminate. So we have people who have severe mental illness and a cancer diagnosis. Some of those people are really plugged into the community already. They've built their support systems. They have their providers in the community treating their mental health. And so we can be an adjunct to that. We can add on information about how cancer impacts someone emotionally. We have a great psychiatrist on our team who helps make sure that that the medication for their mental health need complements the medication that they need for their cancer. And we have a great opportunity to be an additional layer of support with some specialty knowledge in cancer. And then sometimes a cancer diagnosis can really have someone experience a significant change in their mental health. And so we certainly are there to support people in those times. And some people haven't identified good community mental health. And so we can kind of provide some services in the interim, but our goal is really to get people into long-term mental health care if they have a significant mental health issue that either predates their cancer or will postdate their cancer, because continuous care is really important, and we want to make sure that they have that in their community.
Starting with what you mentioned, continuing, yes, healthcare. One of your fields of expertise is artificial intelligence or digital intervention, e-health, or how they are called nowadays by different person. But let's put it like this, AI. And of course, nowadays, everyone is talking about advantages, disadvantages, usefulness, useful. So it's an entire debate. And what is your opinion with regard to supportive oncology this time? Is AI an instrument to help? If yes, in which stage of care?
I think we're just beginning to understand the difference that some of these technologies can make. And I think we have a lot to learn, but I'm really excited about the possibilities that exist. And I think that there are different technologies that can be helpful at really every stage of prevention through diagnosis and treatment. We will never have enough mental health providers or navigators or psycho-oncologists to provide care to all the patients who need it. And so I think leveraging technology that people can access throughout their trajectory is really important. And I think it's coming. And so the question to me isn't whether we should or shouldn't be using it, because patients are already using it, but how do we make it safe, and how do we make sure that there is oversight and that it's used ethically? But I I'm not available to my patients at midnight or 2 in the morning. And oftentimes there can be intense anxiety in that moment. So could an app or a chatbot teach them how to do box breathing or run them through a meditation? Or could they ask a question and just get some support? Absolutely. We also know that we create interventions, but different people can benefit from shifts in the intervention, or some need more information and some need less information. And so I think that we could have a great ability to tailor information to our patients' needs and a language that they understand with cultural considerations that are important. I think about the programming that we do at Peterson Life Cancer. A majority of it's in English, which means that many of our patients who speak another language as their primary language don't have the same access to supports. But some of the incredible language abilities that we're seeing that are happening nearly simultaneously now really could create a real opportunity. So I think the opportunities are endless. And I think anytime something new comes along, we get scared. What does it mean for my own job? How do I keep my patients safe? And I think those are really important questions that we have to be asking. I'm not sure that I think the question is, should we use it or should we not use it? But how can we make sure that it's meeting the needs that we see? And how can we make sure that it is used in a safe and ethical way? And we've already seen incredible advances, and I believe that we'll see more. And so asking these questions are going to only help us harness the technology and make it better.
But the AI never can replace that human touch, as we call it, because we know this is the most important part in our job. Yes, that human feeling, human touch, human spirit, like giving support. You mentioned ethical and the notion of ethical use. Yes, and of course, nowadays, when we are talking about digital technologies, AI, there is a lot of misinformation and disinformation all over the internet, on Google or on Dr. Google, like it's called recently, and this became to look as a huge problem. And I would like to ask you, which category of cancer patients are most vulnerable to this danger of misinformation?
Yeah, I guess, I think all patients are vulnerable because oftentimes when a patient hears they have cancer, there can become a desperation to find the right answer or the best treatment. And so certainly I think all of our patients are vulnerable just because getting a cancer diagnosis is such a big shift in a person. I do think that for folks who have less health literacy or less experience digesting research, that it can be particularly difficult to find good sources and to make sure that the information is correct. I think all of our patients are vulnerable, and it's important for us to keep that in mind as we develop these technologies and use them. People are coming in at a very vulnerable time in life, and as clinicians, I think it's our job to really help direct and guide them to the places where they're going to get good information and education.
In our, let's say, field of expertise, and you mentioned about this integrative work that you are doing, besides healing, which is an important part of our work, we have to do two things: to build hope, not to give, to build hope, and to give time, to put it this way. Time, unfortunately, we can't give because we can't control it, but instead we can build hope for patients. And what is hope for Jennifer Bires, or how you define hope after all these years of experience?
I mean, I think no matter what the situation, that there's always something to hope for. And while we can't give time, we can help people manage their perspective around how to utilize their time in a way that feels really meaningful and how to be aware of the constraints and limits of time that may exist. But when I think of hope, I hope that every patient has the opportunity to explore some of the fears and emotions that are coming up with a diagnosis. And I hope that they have the opportunity to build skills to help them manage what they're feeling, but also that they can find hope in really small places, like in something that's beautiful or in a connection, or just the ability to be in the same space with people they love. And that's something that is always available to us. And so thinking about how we talk about hope and what hope means to different people, I think can really broaden that in a way that feels really important.
We talk till now about the patients, but we all know that the caregivers are also an important part
Yes.
because, and it is often said that after a cancer experience, the caregivers went out more damaged, to use this word, internally, emotionally, than the patient itself. Do you have, let's say, special, not programs, but in which extent do you have also caregivers in the organizations that you've mentioned at the beginning?
Yeah. We do have special programming for caregivers because cancer diagnosis doesn't just impact the person who has it, it impacts the entire family. And so we have programming for kids or grandkids or, young members of a family, for caregivers and partners. I think, being a caregiver can be really hard. One, you can't fix what's going on with the person that you love. And oftentimes it's hard for caregivers to take up space or ask for what they need because there's some guilt in doing so when, the person you love is going through something like cancer. So I think spaces for caregivers to connect with other caregivers and to have their own needs met are incredibly important. And oftentimes caregivers don't do that for themselves. And so I'm so glad that you mentioned them because they're really an important part of the team, but also are very much impacted by this. And it's important that they can get help as well, which allows them to show up better as a caregiver.
I want now to, let's say, go back a little bit on your experience, also talking about caregivers. And we all know that cancer diagnosis is a challenge for a family, for a couple, yes, for spouse and spouses. Did you, over your career, face situations when family separate because of cancer, or couples separate themselves?
Yeah.
Because unfortunately today, in our world, when a huge obstacle, such like a cancer diagnosis, it's interfering in the relations, usually people avoid. So did you met such cases?
I certainly I have seen couples and families break up over a cancer diagnosis. But sometimes I wonder, the cancer diagnosis may have been the last big thing that happened in life, but oftentimes those couples have had difficulty communicating or challenges before the diagnosis, and the diagnosis really exacerbates it. And folks who have support and coping mechanisms and good communication oftentimes become closer because of the diagnosis. So I wouldn't say, that cancer is always bad for a relationship, and certainly wouldn't say it's always good, but I think it is really an opportunity for people to think about what the relationship means to them. And anytime we are that close to facing our mortality, it makes us think about all the relationships in our life and how we're spending our time. And so that perspective shift can be a part of a diagnosis. And it's incredibly stressful to have a cancer diagnosis for a couple. I think most of us live very full lives without having many doctor's appointments and treatments and feeling ill. So you layer that on top of it, and it is certainly an additional stressor. That's why I think this connection of whole person care and mind body is so important, because oftentimes there are support and services, but people don't know about it, or they think that it's not for them. And so really helping our patients know what support can exist and connecting them with it is important. And this is a situation where AI could potentially be very helpful. I do a lot of work in the sexual health space, but even for couples, there's stigma to admit when a relationship isn't going well or you're having trouble supporting the person that you love. And so having a non-judgmental, neutral source like a chatbot or even an intervention that's delivered through an app or electronically can make it much more accessible. I think, there's still kinks to work out there, but when I think about some of the things that people are embarrassed to bring up, many of them I think would feel more comfortable asking not a human, but a computer. And it makes it a little more safe to maybe not take that conversation all the way to the end, but to start it and have some normalization and validation in a space that they may not feel comfortable talking to their friends or their physician about.
Since we are approaching the final of our interview, I would like to ask you one final question. In this world out of balance nowadays, how do you see the future of supportive oncology, or how optimistic are you, expert on the future of this supportive oncology or the whole for the patient?
I think, you're right. Mental health is a bigger issue now than ever. And there are a lot of stressors in life, whether they're political, economical, health related. So to me, the importance of psycho-oncology and the importance of people accessing this care is going to become more and more important. But I'm also aware that we're going to have shortages in trained staff, and that funding has never been as good for some of the psychosocial care as it is for some of the medical care. And so I think that it's more important now than ever that we're open to innovation and that we're creating together smart innovation to ensure that people who need access to this type of care can get it. Because one of the biggest issues that I see is access, and we're not going to fix that with more people. We really do need some more innovative solutions that have people driving that train, but that can create access in different ways.
Of course, access to cancer care, equity in cancer care, stigma in cancer care are subjects for a whole other interview. So
right, that's right.
Yeah, thank you very much for your thoughts and your interesting opinions and comments today, Jennifer. Thank you very much, and good luck on your activities.
You too. It was my pleasure. Thank you so much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.